this page, I do not take credit for, nor do I take credit for the next one. These two are really cool, Pathophys. So we're covering physiological adaptation right now, and I don't take credit for these. These were created by my former student, Gina Matthias, which if you were to look on here, because I don't steal intellectual property, you will see Gina Matthias right there. She's now my boss. At the time, she was my student. She had just taken her exam, and these were select alls on her 265 question exam. So, let's go. Now, this page 10, is all the shocks that you're going to get on NCLEX. This is very valuable after you leave me. You keep it close to the boobies and really look at it, because it will help you learn who's in shock, who's doing what happens first. All shocks are not created equal, except for something at the bottom of the page that I wrote. What did I write? Yes, all shock has a low BP and no PP. Let's examine that. It will save your ass. Here we go. What BP did we talk about earlier? Low BP? Okay. The 90/50 we said is everybody. All shock is got a low BP. It's right there in writing. And so we say no BP. The next thing your patient's going to get is no PP. Let's examine why. We said that BP means blood perfusing kidneys. Okay? So that's how your little ass is going to remember it till the day you die. BP, blood perfusing kidneys. And the rest of the organs in your body, but you got to tie the BP and the PP together, because that's first. That's what's going to happen first. The other organs will die later, but the first organ to die will be kidneys. It's called what I wrote, AKI, acute kidney injury. You know yourself, because many of you have already seen my videos. There are two types of kidney problems. One's chronic, one's acute. The chronic took 20 years. The acute can take 2 minutes, depending on what the hell your ass did to the patient. Okay? So it's very acute. It happened right away. It's going to be like, oh my God, what is going on with this patient? So when you're looking at this blood pressure, this is not going to be enough to sustain perfusion to those kidneys. So any patient going down in their blood pressure, look for their kidneys to fail shortly thereafter. So when we're looking at all shock, it's not like you have to guess on this shit. All shock will have a low blood pressure. So therefore, all shock is at risk for AKI. Therefore, boom, all shock has hyperkalemia. Write it.
I have a question.
Yeah.
Not a dumb question.
No, there's no dumb questions.
So, I was told when the blood pressure is low,
Yeah.
somewhere around that,
Yeah.
I'm always getting, what did you look at the map?
Oh, this is critical. That's our next thing, because when you work in ICU or step down, or you're like me, a provider, we talk MAPS, we don't talk BPs. And the MAPS that we talk because of sepsis and shock. And our MAPS are always 65 and up. And that's what we care about. So what you do whenever you think BP, as a nurse, you can get away with that. As a practitioner, you do MAPS. So you're going to put on your page down at the bottom, MAP greater than 65, because that's mean arterial pressure. But we don't get mean arterial pressure readings on the units, on the floor, sorry. You'll only get those in the units. So it depends on where you work. You work on a regular floor. I work in tele.
I work in tele.
Yeah, well, I work in tele too. One of my other little jobs I do. But so when I work in tele, I don't have to know about the maps on my floor. When I go in the units, when I'm on the bleeder cart, which is what I do with that doctor group that wanted to have me do stupid shit on St. Patrick's, that's me on call. I'm on the bleeder cart, which means all patients coming in on the weekend through the units, through the ORs, through the ERs that need any kind of scoping, I'm their girl. But that's when I gotta know my maps, because those are all units. Yeah. So
we have two.
Oh.
And one is a lighter tele, and the one I'm on is more cardio, more serious.
Yeah, so you gotta know your maps. So this page is definitely the page you wanna remember for your maps, okay, since you're on that unit. Now, you guys don't have to calculate maps. Maps are already given to you. It's called mean arterial pressure. If you fail your test like 4 or 5 times, you might get a map question. You sure might. Because the more times you fail, the harder the test becomes, because the test has to grab behind you and pull out some extra crazy questions that nobody ever gets. Because most people get the generic questions that everybody gets. But the more you take your test, the reason why I say it's harder is because you used all those questions up, and now I got to go find some crazy questions. And so you've never seen those before in your life. And it doesn't happen for the first, second test. It's usually the third test and beyond that you're going to get a test straight from hell. Okay, so you just need to know, I give you every level, you're fine. Now, you see how it says the AKI, you put your hyperkalemia or increased K, you put your MAP, less than 65 for your BP. Now, if you look at each shock, they're not created equal, absolutely not. One of the things you're gonna have to know about your shocks is which happened first. And if you look at the hypovolemic, what happened first, which is why I teach it so well? You're right, tachycardia. What is the cause of the patient with hypovolemic shock? What happened to them?
No oxygen.
Read, it's in there. You don't have to make it up.
They're hemorrhaging.
Yes, they either hemorrhaged, or what else could have happened to them? Burns, right? Okay, you get burn questions, I promise you. All right, now let's look at neurogenic, because these shocks are super easy as long as you know what happened to the patient. Neurogenic, neuro, what does it sound like happened? Some type of neuro thing, right? And if you know your neuro, then you know that the neuro is the brain and the spine. So if I'm going into neurogenic shock, I would anticipate something happened to one of those body parts, in particular, spine. Okay? So if you look, this is another word for spinal shock. You see? And then you see the SCI, which is spinal cord injury. And then you even see the TBI, which is the second part of our little neuro, and that is your head injury, okay? Now, for this patient, the magic word on your test is flaccid. That is the magic word on your test, flaccid. Promise.
For which one?
Neurogenic. It's right there. Everything I'm doing is just highlight. Highlight, no added language, just highlighting. Okay, so you see the SCI, tells you why they got it. So if I'm telling you that the spinal cord injury patient has a blood pressure of 88/40, well, then you're kicking into thinking like, fuck my life, she's going into shock. She's probably gonna be flaccid when I walk in the room. Oh, fuck my life, right? So you got this. Now let's do another one. This is the easiest one of all. Unfortunately, I've had experience with it both with my grandson and one of you. So, anaphylaxis, good Lord. You know when this is gonna be your big old nightmare? When that patient's at, my tongue itching. My mouth itching. 911 yesterday. That's what happened in this class. And it wasn't quite that simple. I wish it was, because she was very sick. But she was just sitting like you guys, minding her business, eating her little snacks or whatever. And she got up and she walked out. And back in those days, we were in Bedford. And when she got up and walked out, My daughter used to be in this open area selling like little candies and chips if you guys wanted it. So I had child labor laws being broken. And so there was my little 13-year-old doing that. She's 30 now, to give you some insight. But anyway, the girl walked out where she was, and my daughter comes around the room, Mommy. I'm like, oh shit, what's wrong? And I go out there, and the little girl is sitting in the chair, and she looks really bad. Like, when I told you feeling of doom, that's what I meant. When I told you, I don't know, I just don't feel right, that's what I meant. So people say that shit, and she sure shit did. I said, oh my goodness, what happened? What's wrong? I don't know, I just don't feel right. I said, okay, well, what were you doing right before you came out here? Nothing, I was just taking notes and like eating my peanut M&Ms. I was like, uh-oh. Have you ever felt this way before in your life? And she starts to say, yeah, one time when they gave me penicillin. Oh shit, because what do we know about penicillin? Very big allergy, right? Now, 911 was called. She's still coded on her way to Metro because they took her to, we were out by Bedford. They took her to Bedford Hospital. They life flighted her over to Metro, and she's still coded. That's how sick she really was. Okay, so it's fast. That's the deciding feature. It's fast. Look what it says. 15 to 30 minutes. You don't have much time to be dingy. Okay, so what are you gonna notice first? That damn mouth, throat, lips, face complaints.
Yep.
Oh, you had it?
My son, I have an EpiPen. You know how when you watch Eddie Murphy, how everything just pop up.
Yeah.
He had eaten seafood before, and this time, the last time he ate it, his eyes was itching, his stomach was itching, and everything just started swelling.
Right before your eyes.
I had Benadryl. I put it in his mouth, and
Good nurses. Don't we got Benadryl everywhere, y'all?
Now he travel with EpiPen.
Yeah, oh yeah. My grandson, it was bad. He went for his first haircut. None of us in the family know how to tell him no. So he asked his daddy for the little candies, and the candies were Reese's Pieces. And his daddy said, okay, they get the Reese's Pieces. Now, here's what's funny, because it's that severe. By the way, it's never your first exposure. It's usually more than that. In this kid's case, his first exposure probably was breastfeeding. This was something different. That girl that got the M&Ms and had to be life flighted, she ate peanut M&Ms every day in class. So it wasn't her first exposure either, just like this lady said. So the baby, the three-year-old, my baby, reached down to get the Reese's Pieces. Hands started swelling. And apparently he did like this and ate them. All of this started swelling. And he had just gotten his hair cut, so there was hair in his eye. This unilaterally started swelling. But sadly, he was literally wheezing within seconds. And my daughter was taking him to Ahuja, and I was meeting her there. He had it all. He had to be intubated. I mean, just everything. Just almost died, right? So we know all about anaphylaxis.
Happened to me
At the dental?
at the Zanzibar.
Oh, Zanzibar? What did you eat? Oh, now you're really allergic. And what happened? What did you feel first?
My tongue, I kept using a fork. I couldn't stop itching it. And I itched
You
so
scratch your
bad.
freaking tongue with a fork?
Well,
I'ma slap you. Oh my God, my baby.
it's my
Like
tongue-
this?
Yeah, I was scratching. My tongue swelled up. I couldn't even. It was like this.
Did they call 911?
Yeah.
Oh, good. Because you can't get in the car, you'd be dead.
I couldn't get air. I couldn't.
He couldn't get air. He could not get air. Now, what do you think about this? Here's our problem. Look, there's our tacky again, right? You see it? You see the anxiety? Sounds like a behavior change, doesn't it, y'all? You gotta really notice all these now that you know your shit. And then you see the tongue and the lips and all this crap. So that's the distinguishing feature, because frankly, none of these other people are gonna have tongue, lip, face, throat complaints. So you will know that shock from all the others. Fast occurring, gotta act quickly, okay? All right, now respiratory, oh, no, let's do another shock, because these are just distress. Let's go up to septic shock. That one is the hypovolemic is number one most common. Septic is number 2. So as a nurse, I put these at the top because so many of you put these in your coats, your little lap or your scrub pockets at work. So we just tell you these two are the ones you want to know the most. Okay, so if you look at septic shock, this is fucking easy as hell. It's the fever. Hello. And if it's not a fever, it's your white blood count. It will take you a second to clue in, but once you do, you know to look at that fever and the white blood count. Sepsis kills more than heart attacks, strokes, and cancer combined. That's why I chose to do that poster presentation. So this is huge. You will be considered everything in your hospital when you save the patient from this. Now we have the epic sepsis alerts. They're gonna tell you when 3 of the things on this list are abnormal. And that's what you wanna pay attention to. You kinda get in major trouble when you don't pay attention to sepsis alerts. What is the number 1 or 2 culprit? E. coli. What did you learn about E. coli? Where's that from? The gut. Oh, what I tell you? All GI is dirty. That's GI. And then the H flu is respiratory. So you have either caught sepsis from a GI issue or a respiratory issue. That's what these are. Now, if you don't have the fever, you obviously gonna have the high white blood count. But then you see something on here that I want you to highlight because you probably don't know what it is and I wanna teach you. You see something on there that says left shift. Holler it back at your girl. Okay, left shift. Now listen here. This is a favorite on NCLEX, okay? And I was really shocked when my LPN told me she had it. I was like, what the fuck? Are you serious? It's crazy. The left shift is when your patient is so sick that all of their regular white blood cells have been devoured, okay? What that means is your patient has a not so high white blood count, but they have a very high neutrophil or basophil count. Here's all you care about on your test. With a left shift, I compare it to like the Civil War, because we never did that after the Civil War, but we did it in the Civil War. In the Civil War, we lost so many men on both sides that both sides enrolled kids into the war. Like you were 15, you're going to war. You're 16, you're getting in the army. We never did that again. This is the same thing that happens in your body. You have such a horrifying infection that all of your mature white blood cells have been destroyed. Now the body is desperate to save itself, so it kicks out immature white blood cells. And immature white blood cells are called neutrophils or basophils. So if you see a left shift, it's because the neutrophils and basophils are so high because the white blood count can't keep up with this raging infection. You gotta know that means sepsis. When I see a left shift on babies I've delivered, I'm like, oh my God, I don't know if it's gonna make it, because that's what it means. We don't know if you're gonna make it. It's pretty severe, okay? So babies, adults, don't matter. Left shifts are really, really bad, and your infection is raging and taking over your body. Okay, so that's what that means. But I probably better highlight that bad boy. Let me see if there's anything else exciting. Oh, no. Yeah, here we go. Look at the treatment. You're gonna have linezolid on your test. That's on your test. This is a very serious antibiotic. This is the last word under septic shock. It is a very serious broad spectrum antibiotic. We call it triples and stuff like that we do to you, but this one in particular is for sepsis. Okay, you're gonna hang a lot of that shit. Okay, cardiogenic shock. You cannot miss this on the chest. I will beat you until you bleed. You cannot miss it. You know why you can't miss it? Because there's no way to have a cardiogenic shock without a patient with CHF first. They're gonna say that right in the damn thing. They're gonna say it right in the case study. The patient has congestive heart failure. Boom. No other person, nothing else she could be. Now, you want to remember this. I don't, oh yeah, I did put it on there. Lord, every now and then I shock myself. Look, y'all, look at the lab. The last sentence under there, that shit is golden. They're going to have a high BNP. Y'all remember? Now listen, ladies and gentlemen. If we, and I, and you, and me, took a little trip up to Hillcrest, got our blood drawn, did a BNP level, we would all be around 50 or under. When you have heart failure, you are above 50, you're damn sure above 100. When you have heart failure exacerbation, you are in the thousands. Exactly. And the reason you're in the thousands is because with heart failure, fluid is building up in your body, causing your ventricles to work harder. And because they're working harder with more fluid backing up, they're going to put out this chemical, this hormone called BNP. So we can settle this right away. We can figure out if you're having a CHF exacerbation by making the BNP part of our lab work. That was on your test. All right. Now, so you got it? Hypovolemic, neurogenic, anaphylactic, septic, and cardiogenic. Are you good? Now you just got 3 more pathophysiology things to remember. When your patient goes into distress from either a respiratory condition, cardiac condition, or a neuro condition, these are your select alls. I want to tackle neuro a little closer because when you know your neuro, oh my goodness, you know everything neuro. So here we go. Watch this. Do you remember me saying that neuro is brain and spine? Okie dokie. When it comes to signs and symptoms, you have to really know what I'm about to say and remember it forever. Like I'm talking about like forever. Okay, so neuro is always. Did I say always? Yeah, always. High BP. Always. Headache. There go my baby. Always. Seizure precautions. Always brisk DTRs. Always clonus. You feeling me yet? So you ain't walking all up in my house talking about you got a little neuro problem and you ain't got none of this. It's impossible. Okay? TBI, all kinds of crazy. Okay? Now, you have to be careful because if you get too caught up in my always for neurogenic or for neuro distress, you will forget what I taught you about neurogenic shock. If you look at neurogenic shock, it completely defies the odds. It's all vital signs are low because after all, it's shock. So you could never have a high blood pressure with shock. So these are your crises, right? Hypertensive crises, neuro. Stroke patient, neuro. TBI, traumatic brain injury, head injury, closed head injury, neuro. Okay? This is what this is. You feeling me? Okay? So if I say, oh, your patient has a subarachnoid hemorrhage, boom, run it down. If I say, oh, they had a recent stroke like your classmate did, stroke right in the class, run it down. So all gonna be there, every bit of it, okay? You're gonna be okay. This is neuro. You gotta know your neuro, okay? If I say neuroleptic malignant syndrome, well, yes, it's a psych patient with a high fever, but what the fuck, it had neuro in the title, so guess what? This is that patient as well. You see? Okay. If I say that your patient has meningitis, meningitis is neuro. Boom. Everything neuro. Boom. Okay, so if you look, you see your neural distress. There's one tricky one that you guys never remember. Neuro is the only system out of the 16 I could label off, the only body system that has bradycardia. All the rest have tachycardia. It's the only one. And that, my dear, is golden. So you see it says it. And I put stars, stripper glitter. I would prick my finger and bleed on it, spray it with some perfumes, take my gum out my mouth, stick it in it. I would do whatever I had to do to remember that shit. It's the only system with a bradycardia. Everybody else has a tachycardia. Okay? Now, my wish for you, even though this says neuro, let's hook our little selves up. Let's put low calcium for that one. Because low calcium is going to give you neuro. Low calcium is going to give you neuro. Do you see where it says Cushing's triad? One of the things you had to remember, but you normally don't, is that Cushing's triad means ominous sign. It means your patient's that close to death. So when you see Cushing's triad, it's not early. It's late in the presentation. And it means they're going to die if you don't hurry up and figure shit out. So they will ask you, is it early or late? It's definitely very late, this Cushing's triad. And it's down there. And you see what I wrote. Cushing's triad. And anytime you hear triad, you guys know it's three things. So I put 4 just to make sure you had a little extra love. It's high BP. It's low pulse. It's a widened pulse pressure. And you see the low shallow respirations. Okay? Now, respiratory, we've been there, done that. T-shirt, sun visor. We're not going back there. You know it's a respiratory song. Do you see all the parts of the song? Mm-hmm. Yes, indeedy, sweetie. Cardiac distress, on the other hand, is a whole nother ball game. So let me tell you the number one, and you might have heard me say it with that lady that had that heart rate in the 30s. Let me tell you the number one thing you ought to ask your patient with cardiac drama. Do you see where it says, do you get dizzy? You see that dizzy and syncope? Highlight that bad boy, put stars all around it. Because that is what denotes cardiac from everything else. Dizzy and syncope is not respiratory. Dizzy and syncope is not neuro. Dizzy and syncope is cardiac. Do you feel like you could faint? Did you fall recently from feeling like you could faint? Do you get lightheaded? Do you get dizzy? Cardiac all damn day. Okay, so there are other things here, but they could cross over into other disciplines. Chest pain is a given. You'd have to be like born yesterday not to know that. You can see some of the blood. Oh, I gave you core measures. I don't believe I did that. That's pretty cool. Look under your cardiac distress and look at the last entry. I gave you a little ass core measures. Here's what core measures are. Core measures are what needs to happen by what time or your hospital is going to get closed. Like you'll all be fired, okay? So core measures are what must you do in your hospital to stay open and be called a cardiac center or stroke center or whatever. When should you have that EKG and that aspirin in that patient with chest pain? By what?
10 minutes.
10 minutes. You blow that off and fuck that up, oh, you don't like your hospital. You don't even like working there no more. What about the cath lab? When should you have had that patient in that damn cath lab? 90 minutes. Those are called core measures. Don't fuck that up. All righty. That's that. Now turn the page. The next